Hi everyone, it's February 5th, 2026, and welcome to the monthly Dr. Fox live Q&A where we answer all of your health questions live. My name is Abraham. I'm an advanced medical practitioner and pharmacist and the lead of the YouTube channel here at Dr. Fox. We're an online doctor and pharmacy where we create science-backed content focused on health and well-being. We go live every first Thursday of the month, so mark it in your calendars and we're going to dive into your questions. Just a little bit of housekeeping before we begin. All the questions I answer today have been submitted by viewers like yourselves through comments on our videos and our social media. So if you ever have a health question, just drop a comment and we'll try and include it in this live session. Or if we don't have time in this live session, we'll do it in next month. And don't worry if you miss this live whilst we are live, leave a comment here and we'll answer it in next month's episode or in any of our videos. We reply to every single comment, so don't worry, it won't get missed. Also, just to let you know, I have two tabs open, so I keep flicking back and forth. So if you leave a comment, I will get back to you, so don't worry. Okay, let's dive straight into it then. So this is a question from DilZGFX. That's a bit of a difficult one. So are there any herbal supplements that have been proven to lower DHT levels like saw palmetto? This is on our hair loss video that went live a couple of weeks ago, and it's been getting a lot of views and helping a lot of people. So this is a great question. This comes up a lot on videos and patients ask me about it, about DHT and male pattern hair loss. So I'm going to break down what the research actually shows and also what makes a study strong or weak, because that's really key to understanding this topic. So when people mention herbal supplements like saw palmetto or pumpkin seed oil, for example, a lot of patients ask me about that. The idea usually comes from test tube studies, for example, or very small human trials. Now, the problem is that these studies, they don't meet standards we need to say something is proven. A strong clinical study, the kind we rely on medicine, usually has a few things. So it has a large number of participants. It has a control group. It has randomization. So people are picked in a non-biased way, basically. We have blinding. So that means participants don't know whether they're taking the actual medicine or a placebo, for example. We have clear measurable outcomes. So in this case, actual changes in DHT levels or proven effects on hair loss. And most importantly, the results need to be repeatable across other studies, basically, more than one study. So when you look at herbal supplement research, most studies do not tick those boxes. So for example, saw palmetto is being shown in studies. It's probably one of the most looked at and researched supplements, actually, but some small trials suggest it might be partially inhibiting 5-alpha reductase, and that's the enzyme that makes DHT. But studies usually have 20, 40, maybe 60 people, and that's no way near the size for strong evidence. The extract used also varies in these studies. Doses vary in the studies. And some studies have shown a small reduction in DHT, whilst others show no difference at all. So that inconsistency tells us the real effect, if there is one, and it's probably weak and unreliable. And this brings me on to another point, the difference between correlation and causation. So this is something I discussed a lot as well on the channel. A correlation is when two things appear linked. So for example, someone takes a supplement and also notices their hair seems better, for example. But that doesn't prove that the supplement caused the change. It could be placebo. It could be natural fluctuations. It could be a change in routine. They might have, been eating a healthier diet, that month. They might have been doing more exercise. They might have not been doing such strict exercise. They might have changed their hair cycle. So, or even simpler coincidence. So to prove causation, you need high quality evidence. You need to show basically that supplement consistently produces the effect across large, well-designed studies. And we just don't have that for herbal DHT blockers. And on top of that, supplements are not regulated like medicines. So the strength and purity can vary a lot, making the results even harder to interpret. So I guess where does that leave us? Right now, based on proper clinical evidence, no herbal supplement has been proven in large, high-quality trials to meaningfully lower DHT or treat male pattern hair loss. Some people do try saw palmetto, but even the best studies show that they are much weaker and far more inconsistent than licensed treatments like finasteride. So Herbal supplements fall into the category of interesting, possible, but not proven. And of course, if you ever want to try taking a supplement or anything like that, please speak to your medical provider about it first. And when it comes to male pattern hair loss, the treatments with the strongest evidence remain finasteride and minoxidil. These are some of the things that we discuss in the actual video. We go through the treatments for hair loss. So if you haven't watched that, we'll link it here and definitely go and give that a watch after. All right, so I'm just quickly going to pop over to the comment section. We got a comment from Lady H saying hello. Hello, thank you for tuning in. Random question. I'm going on a vacation with my friends, and I heard from friends that lemon can delay periods. Is this true? How much lemon juice would work? Okay, this is a great question, by the way. So, well, I hope you're going on a nice holiday and a nice vacation with your friends. So I've heard this before, actually. I've had patients ask me about lemon juice and delaying their period. So no, lemon juice does not stop or delay your period, and there is no clinical evidence that it affects menstrual bleeding at all. When people ask about stopping their period, my thinking isn't about these hacks. I'm thinking which hormones are active, what's safe, what will genuinely hold the uterine lining stable. And that's the difference between internet advice and actual medical advice when you see your medical provider. From a clinical point of view, only hormonal methods can delay a period. Things like lemon juice, I've even heard apple cider vinegar, I've even heard cinnamon water. These are really common online suggestions, but they don't influence your hormones. They don't stabilize the uterine lining. They don't prevent bleeding. And what I actually see in practice from patients is, stomach irritation, reflux, people blaming themselves why it doesn't work. So I guess the question is, what does work? If someone's already using combined hormonal contraceptives, so whether it's the pill, whether the patch, or whether the ring, that's usually the simplest solution in practice. So these both contain estrogen and progesterone, which keeps hormone levels stable. And clinically, stable hormone levels means that you can often delay bleeding by skipping the hormone-free break. But that needs to be confirmed with your doctor or pharmacist first, because using contraception incorrectly can obviously reduce protection. But if someone isn't on the contraception and wants short-term delay of, their period, there are prescription-only options like norethisterone or medroxyprogesterone, and they work by telling the uterus, like, hey, hold on, to the lining, basically. But timing does matter, and that's another important fact to remember, that they need to be started at least 3 days before your expected period. And again, these are not a contraceptive, so you must speak to your medical provider about them to make sure they're safe and suitable for you. Because from a safety point of view, things like migraines of aura, high blood pressure, smoking if you're over 35, they can make estrogen unsuitable. So delaying your period is always about individual risk, and it's not something for you to adjust without any guidance. So to bring it back to question, lemon juice, it doesn't delay periods. Apple cider vinegar doesn't. Cinnamon water doesn't. They're myths, and they don't influence your hormone levels to control your cycle. And if you want a full explanation, by the way, we do have videos on the channel where we go through how to delay your period. So definitely do give that a watch. I really do hope that's helpful. I'm just going to have a sip of water. All right. So we're doing good so far. I'm just going to put the live caption back up. So I'm just going to fly back to our comments, questions. So the next question is from Adrian. What actually causes erectile dysfunction, and what are the first things clinicians look at before treatment? I love this question, by the way, and this is exactly how clinicians approach ED in real practice. So when a man tells me he's struggling with erections, I don't start straight away with treatment. I start with the pathway, okay? So an erection depends on 3 things working together. So you need good blood flow, you need clear nerve signals from the brain, and you need the right psychological environment. So if blood flow is restricted, nerve signaling is disrupted, or stress interferes with the process, erections naturally become quite unreliable. So clinically, some of the most common physical contributors are high blood pressure, diabetes, high cholesterol, and narrowing of blood vessels. But the important part is that it's not just having those conditions, okay, that cause it. It's how well are they controlled? Because poorly controlled blood pressure affects penile blood flow. poorly controlled blood sugars. It affects both the nerves and the blood vessels. And that's even before diabetes is formally diagnosed, by the way. So, and another thing as well, thinking about is psychological factors. They matter too. So stress, anxiety, depression, relationship issues, these can all cause disruption. And in younger men, it's often the leading cause that I see in practice, by the way. So just bear that in mind. Another point as well is medication. Medication can also contribute to erectile dysfunction. It's one that not a lot of people think about, but your medical provider will be thinking these sort of things, especially some antidepressants, some blood pressure medication like beta blockers, and aldothioxide diuretics as well. Actually, they can sometimes cause it. And that's why a medication review should always be part of a good erectile dysfunction assessment. And just to stress this for anyone watching, if you are taking any of these medicines, please never stop or change prescribed medication on your own. You must always speak to your doctor or medical provider about it. And of course, if you are struggling with erectile dysfunction, always, always, always speak to your healthcare professional. That is the take-home message. But the next question, I guess, is what helps? Because I'm sure, that's a useful thing to know, like what helps in terms of lifestyle, because for many men, the first improvements come from lifestyle changes because they are, they're acting directly on circulation, on your hormones and your nerve health. So from a clinical standpoint, these are my non-negotiables. Firstly, regular exercise. It supports your heart, your blood vessel function, and your overall circulation. So it's a must. Reducing excess belly fat. This improves testosterone balance. If you smoke, stopping smoking. Nicotine tightens your blood vessels. If you drink a lot of alcohol, reducing your alcohol intake because heavy intake dulls nerve sensitivity. Obviously, stopping smoking is crucial. If you can stop drinking alcohol, because alcohol is pretty much harmful for every cell in our body, it's also going to help. It's not a bad thing. And managing stress and improving sleep, because sleep is a big one, and not enough people are talking about this when it comes to erectile dysfunction. Poor sleep lowers testosterone, raises our stress hormones as well, and a combination that interferes heavily with sexual response. So these changes, it's also important to remember, they don't work overnight, but when ED is caused by circulation, hormones, or stress, they are the foundation that every single treatment sits on. So don't take these lightly. Really look at yourself and analyze and think, can I make some of these adjustments to my lifestyle? Okay, I hope that helped. We are looking good. We're good on comments, guys. Thanks a lot for tuning in. All right, let's go to the next comment whilst I have a sip of water. Okay, the next comment is from Del Maurice 9668. And again, this is from our hair loss video. Hair loss may also be caused by vitamin D and zinc deficiencies, poor skincare, toxic medications, stress, and poor thyroid function. So that's just a very big statement, and thank you for commenting. I just wanted to go into a bit of detail on that because it comes up a lot. So there is some evidence linking vitamin D deficiency with certain types of hair loss, particularly telogen effluvium, as well as alopecia. That said, most studies show an association rather than a clear cause, kind of like what we spoke about earlier. And supplementing vitamin D has not been shown to regrow hair if levels are already normal. The same also applies for zinc. Yes, severe zinc deficiency can cause hair shedding, and correcting a proven deficiency may support overall hair health. That is correct. But taking zinc supplements when you're not deficient hasn't been shown to reliably improve hair growth and can cause problems if taken in excess as well, by the way. Stress is another recognized factor. Significant physical or emotional stress can trigger temporary hair shedding, known as telogen effluvium. I've seen this many times in patients. This usually happens a few months after the stressor, by the way. So you might be really stressed for a period of a month, and then things get back to normal again. And then a few months later, you start to notice that shedding. So, hair gradually recovers over time, by the way, once those stress causes settle. Thyroid function also plays a role. Both underactive and overactive thyroid can disrupt hair growth, and it can lead to diffuse thinning. And if someone has symptoms suggestive of thyroid disease, blood tests can help identify this, and treating the imbalance may improve hair health. Now, the key point is that these factors, yes, they can contribute to hair loss in some people, but they are not the cause for everyone, and evidence varies depending on the type of hair loss. And this is why it's not a good idea just to start supplementation with supplements just because you think you might need them. I know sometimes it can be very tempting because you heard it from X person and Y person, but it's really important that you always speak to your medical provider if you are struggling with hair loss, so they can look into this and do the blood tests that are required to see if you're deficient, to see if you need anything, before self-diagnosing and self-treating. So I really hope that was helpful. Just tuning back into the comments section, I can see we are clear. So I'm just going to move on to our next comment. All right, so we're doing good, by the way. So this comment comes from Shibbles24, and the question is, how do you apply minoxidil or finasteride solution to your scalp? It's interesting. This month's live has been very much focused on hair loss, but I guess it's because one of our first videos, I think, was on hair loss that we released on the channel. By the way, we have daily health videos now on the channel, both short and long videos. So make sure to subscribe to stay up to date. But let's talk about minoxidil. Let's talk about how to apply topical minoxidil, so that the solution, or even topical finasteride, by the way, on your scalp. So most people are told, sometimes not even told, I guess they're just prescribed, and you know, the directions might say apply once daily, but they're never told exactly how to use it properly, or just maybe told to just rub it onto your scalp. But if you're not using it right, you're not going to get the best absorption or the best results. So, excuse me. So, in terms of clinically speaking, and this is where I want to use my pharmacist hat now to tell you about how to actually use minoxidil or finasteride solution. So, before applying it, and you're not going to hear this anywhere else, this is my own tip. You want to do a scalp massage. So for 4 minutes, I want everyone to do a scalp massage before you apply minoxidil or finasteride solution. And you won't read this on the leaflet, but basically gently massaging your scalp is going to improve your blood flow to the area, and that's going to help with absorption. In terms of how to do the massage, I'm going to try and demonstrate this on screen for you. You don't need to get your fingers into your scalp like this. So what you need to do is keep your hands like that, flat, and just move your scalp like so. Okay, and just work your way across your scalp on the top and just moving it like that. So this basically just moves your scalp up and down. So we're not really moving the hairs, we're just moving that scalp to really get that blood circulation. And you only really need to do it for 4 minutes. After that, you need to make sure your scalp is completely dry, no sweat, no dampness. Don't be using it after you've come straight out of the shower. That's the worst idea because water can dilute the medication and reduce how well it's absorbed. And then when applying the solution, don't just spray it onto the hair or drop it onto the hair. Part the hair a little bit, or if you can, if it's got like a dropper, imagine this is the dropper tip, really kind of get it into the scalp and then drop it. Okay, so wherever you are losing hair or thinning in that area, pop it there onto the scalp and then drop, you know, the measured amount or however you're told to use it. The most important thing is don't use the whole amount. Like, let's say if you're meant to use this much of the dropper solution that's in the tube, don't just do it all in one go. Do a few drops, and then after that, gently with your fingertips, and make sure your hands are clean, nice and dry. Get your fingertips on the scalp and gently just rub it in. Okay, just rub it in like so. Easy as that. And just do that on those areas that are thinning, and that's essentially how you apply it. Follow the instructions on how often to use it, whether it's once a day, twice a day, and how often to use. And after applying it, wash your hands and let the scalp air dry naturally. That's really important. I've seen patients and I've heard patients using a hairdryer afterwards. You don't want to be doing that. Also, avoid any hats or styling products for at least 2 hours after application, so the medication has time to work and absorb. And one thing that's really important, and I tell patients this all the time, by the way, is be consistent and be patient. Please do not expect, you know, rapid growth a week after you start using it. It takes time. It takes 3 to 6 months to really start showing its effect. And sometimes also when you start minoxidil, shedding can temporarily increase as well, which can also be hard, especially if you're losing hair. And I completely get that, because it's always scary when you're losing hair and you're seeing it in your hands, and you're seeing it on your towel, and you're seeing it in the bathtub or in your shower, and it's never a nice feeling. But you've just got to be consistent and follow your doctor or your healthcare provider's instructions. So I really hope that was helpful in terms of how to apply minoxidil or finasteride solution. And if you want a full step-by-step version where I actually demonstrate it a lot clearer, go and watch the full video. It's on the channel, and that's how you do it. I'm just going to quickly flick over and make sure we are up to date with all comments, which we are. Perfect. So it looks like we've come to the end of this month's live show on Dr. Fox. Thank you for watching. If you're watching this video after it's gone live, which a lot of people do usually log in after it's gone live, we have a new live Q&A every single month. It's the first Thursday of the month at 5 p.m. GMT. So if you're watching this after it's gone live and you've got a question for me, leave a comment on this video or on any of our daily health videos. We reply and respond to every comment, and we'll note those questions and I will answer it in next month's episode. So please do not worry. We've got plenty more episodes coming up, and I will see you in next month's episode. Also, make sure to subscribe to our channel to stay up to date with our daily health videos. And as we always say, have a great day. And please remember, Dr. Fox, discreet care delivered direct to your door.